Tiffany, a registered nurse here at Bellissimo Medical, and today we're going to talk about functional medicine and the difference between functional medicine and traditional medicine.
Hi, my name is Dr. Nerette. I'm the owner of Bellissimo Medical in Western Florida. Thank you for taking the time and listening.
Okay, so just a couple questions that patients usually have about functional medicine. Dr. Nerette, please tell me your qualifications and experience in the field and how you got into functional medicine.
Okay. I graduated from NYU, Downtown Hospital, as an internal medicine doctor. It wasn't long until I realized I wasn't helping people. I was only managing their disease state. So after a year or so of doing that, I just looked for something else that I could impact patients and actually fix their disease, not just manage the disease progress. And I found functional medicine, thank God. The difference really between functional medicine and traditional medicine, what you normally see your doctor for, is we do not manage disease. We see that a lot here. For example, if you have blood pressure problems, your doctor gives you a blood pressure medication, yet when you come and see me, you still have high blood pressure. So that's managing a disease. You want to treat the underlying cause of why for example, a 40 or 50-year-old gentleman will have high blood pressure all of a sudden. The second thing that I really like with functional medicine is the ability of balancing their whole system, and you fix that patient using natural supplements. And we try to stay away from chemicals, pharmaceuticals, things that are not natural. If you do that, as you can imagine, fixing the problem and balancing the whole body, that's when the patient can feel 100%.
Another question we have, why do people typically choose Bellissimo Medical, and what are some of the patient frustrations with traditional medical care?
That's a loaded question. I mean, I think that people come here I am not just a hormone doctor. We practice functional medicine, and that is really the key. That's what's going to keep the patient well, and that's how we're going to prevent disease tomorrow. There's a lot of clinics and medical practitioners that actually call themselves hormone doctors, and they'll do some blood work, very simple blood work. Some people don't even do blood work, and everyone gets the same cocktail of hormones. In functional medicine, is the opposite. Yes, the hormones are important. It's about only 20%, but you need to fix the 80%. Do you have the right vitamins, the right minerals, the right diets? Are you eating enough? Are you exercising? All that is what's going to make the hormones, if you do need it, work even better.
Is functional medicine safe for everybody, and who can benefit for this type of specialized?
Yeah. Yes, definitely safe.
Similar.
It's safe for everyone. I think if you don't do, my personal reasoning, if you don't do functional medicine, then it is not safe for you. Because we look at the underlying problem. And my youngest patient is 6 months old. My oldest one is 90-something old. Always look for the underlying imbalance. Why is the sick nauseated? Why is he having diarrhea? Why is he not feeling well? It's not all about giving a prescription or antibiotic, trying to find out the root of the source. And most importantly, you are going to fix that patient with something natural. How can it not be for everyone?
Mm-hmm. So if I were to be a patient, which we are patients here, what can we expect from our first functional medicine appointment?
Okay. When you think about functional medicine, in general, we're all very anal people. I want to know everything about you. We have a very detailed intake form that I want to know how well do you sleep, how tired do you wake up, any weight gain, any history of birth control pills, of using drugs, any recent medication, antibiotics, things that are not necessarily so typical compared from traditional to function is very important for us. For example, we discuss all the time your toxicity. I think a woman are the most toxic patients out there. Exactly. The recent studies show that a woman in the United States, before they go to work, they actually apply 300 to 500 toxins, not chemicals, but toxins in the body like lipstick, the makeup, the blush, the hair and nail supplies. So we always are thinking, how can I detox this patient slowly but surely every day? And it's those toxins are there, one of the reasons of why the patient is sick, why the patient is gaining weight, why the thyroid is not working correctly, or why do they have an autoimmune disorder when they should really have none. For example, almost every patient I see, I look into the mouth. You want to see, do they have heavy metals, mercury, or amalgams, like they call it, that we used to use a lot, because heavy metals are not supposed to be in your body, and now we know it could cause a lot of chronic medical issues.
Okay. So since we're talking about specialized testing, what other tests do we do in functional medicine versus traditional medicine that benefit the patient?
Yeah, the testing are very important. We use very specialized functional medicine labs. For example, we're talking about toxicity, so checking for heavy metal toxins using a urine sample. Normally I use a particular lab in the Midwest. We have an environmental toxins, which I love to do. It looks at over 150 different toxins that we're exposed to every day. It's not only the makeup, but the water, the plastic bottle, some of the food, the alcohols, and things that we do not know exactly, is this harmful to me or not. But we do very specialized testing, for example, looking at your adrenals. Your adrenals is a very specialized gland on top of your kidney, and it has to do with multiple things, from your brain, your heart, your weight, your blood sugar, your thyroid, your immunity. And imagine if no one has ever tested your adrenals, they could not really evaluate your, let's say, your transmission to see how healthy are you, or what can we do to make you healthy, to increase your immunity so you will not get sick, to fix the cortisol, which is a very important stress hormone, so we could decrease the weight and inflammation in the gut, the brain, and the heart. So we do numerous different, very specialized testing that is all approved by the FDA, showing that it does work. And most importantly, we have a lot of medical studies. It's called evidence-based medicine, that shows that fixing the adrenals, fixing the toxicity, and so forth, there's some positive improvement in a patient's life.
Okay. So one of our biggest questions here at the practice is, what is the difference between our supplements that we buy at Walgreens or other places and medical grade supplements that we sell here in the practice?
Yeah, and there has been a lot of news about that. And really the number one I will say is bioavailability, meaning that if you buy a supplement from a local grocery store versus medical grade, let's say it's 100 milligrams of omega-3, I want you to be able to absorb 100 milligrams of omega-3 or close to that. The other supplements over the counter, they don't have the purity and the science behind that. So yes, even though they say there's 100, first of all, there might not be 100 in the bottle, because it's not that well regulated, and because it's not as pure, you're gonna have a problem swallowing 100. I think one of the biggest thing in the news lately, during the last year, is showing how pea protein, non-medical grade pea protein, has been contaminated with different toxins. So it has everything to do with purity and bioavailability. The price difference is minimal, so it's not a pricing issue, it's more of a knowledge issue that if you do need supplements, whatever you put in your mouth better be the best thing that you can, and to get it from a functional medicine doctor that has the right supplements for you.
Another question we have is for patients that are international and there is no functional medicine in their countries, what do we offer to bring in international patients, and how do we contact them?
I mean, my goal and our goal at Bellissimo is really to impact as many people as possible. I do not want the distance or the barrier to be a consequence of not doing so. So we do everything for our patients, and I think that's what makes Bellissimo so unique. Everything has to do with the patient number one, patient number two, patient number three. So depending on the issues, you know, we do Skype, we do FaceTime, we do email, whatever way to be able to get in front of the patient, get enough information. They will still be able to log into our system through the portal and to be able to fill out the history questionnaire, which helps me a lot. Once I get that, we do send them a prescription that most countries are able to do, so they'll be able to do the lab work in their country. So by the time that they come here, with the help with our office manager that will help with the lodging, will help them get in there, whatever they might need, even with transportation. I mean, I've been known to pick patients up from the airport, my staff, you know, so really we'll do everything for our patient to feel comfortable. And by the time that they come here the first time, I will have already their history form. I already have spoken to them numerous of times on the phone, and I will already have the treatment plan. So it will be within 1 or 2 days they will be able to get treated and start feeling better right away.
Okay. Well, thank you, Dr. Nerette, for answering our big questions on functional medicine, and please visit our website bellissimomedical.com or call our office for more information.
Thank you, and thank you for listening. The most important thing is we do complimentary consultations. So if you have a particular issue that you want to know more information, can I help, what do I need to do, please don't hesitate. We're here for you. The more information that you have about functional medicine, the better it's going to be for you and your family members. Thank you so much for listening.